So I'm here today with a more recent transtracheal patient. I'm going to ask him to introduce himself to you, tell him just a little bit about his background, and then we'll go from there into a little bit of an interview.
My name is Patrick Woltemath. I am 58 years old. I am a transtracheal user, and I would like to speak to you today about transtracheal oxygen and its benefits.
Okay, so Patrick is a fairly recent transtracheal patient. I was a little bit off. Patrick, when was your transtracheal procedure done?
February 14th of 2014.
February 14th of 2014, so a little over a year-ish in terms of experience. And can you tell me just a little bit about your previous situation? In other words, what made you turn to the doctors that would eventually prescribe transtracheal oxygen?
I had been diagnosed with COPD, and my oxygen use was becoming more and more. And my brother had died from COPD, and so I knew the eventuality of this. And I wanted to see if I could slow the progression and breathe better. And that's when I started inquiring about transtracheal oxygen.
Okay. And so I ask this question every time, but so you more or less had to let your fingers do the walking through the yellow pages on the computer to find transtracheal oxygen?
Yes.
Okay, can you describe how that kind of happened?
Well, my oxygen use was increasing. I was increasingly using more oxygen and having more trouble breathing. And so I looked on the internet to research COPD and treatment, and that's when I found the transtracheal oxygen.
Okay, and when you found TTO on the website and went through whether it's the questions or anything else, did it put you off a little bit, or were you kind of ready for it at this point?
Oh no, once I found out that they had to make an opening in my throat, I was not happy.
I am so glad actually to hear that, because that is a very, very common and typical response. So as the days and weeks and months went by, there must have been either a tipping point or a doctor or somebody that said, you know, Patrick.
Yes, I needed to increase the oxygen again.
Okay.
And through this, I was able to do less and less physical activity.
Okay.
And so that's when I inquired with my doctor about using transtracheal oxygen.
Okay. And so you're at I'm guessing a typical doctor visit, office visit, and you're sitting basically across the old desk or treatment table from the doctor, and you say, hey, doc, what do you know about transtracheal oxygen? Is that kind of how it went down?
Pretty much, yes.
Okay, yeah.
And he explained to me that I would have to go see another doctor, Dr. Michael Schwartz at National Jewish, and to find out if I was a candidate for transtracheal oxygen.
Okay, so just don't want to let this go right now. Your flows were going up.
Yes.
And you were monitoring your oxygen.
Yes.
Because you're a good patient. And so in spite of increasing flows, your saturations were staying the same or not as high?
They were continuing to drop.
To drop, okay.
Yes.
So you more or less used Spockian logic and said, okay.
Yes.
Okay.
I need to do something.
I need to do something. Okay, that's great. So you are we've done quite a bit of research here, roughly 10% only of patients who actually go out to try to find a better way. 80% of the patients sit on the fence for quite a long time and almost always have to have transtracheal rather than, I'll get it now, way before I have to have transtracheal. And then 10% are pretty sick and probably just not good candidates for transtrach. But you're what we call an early adopter.
Okay.
Okay, and so you adopted, and how are you adapting?
I am adapting extremely well.
How hard or difficult was the immediate, let's say, week or 2 or 3, and be honest, post-op period following the procedure?
The first couple of weeks, it was uncomfortable.
Okay.
And I wasn't sure that I made the right decision. By the end of the 3rd week, I was very impressed. I knew there was not going to be any going back.
Okay. Let me follow that up with this question. The effects of transtracheal oxygen are rather immediate. I mean,
it was immediate.
Thank you.
They made an opening in my throat on a Thursday. Friday morning, they put the tracheal tube in and hooked me up to oxygen. And after about 3 or 4 breaths, I looked over at my hospital window because I thought someone opened the blinds. It was like everything just lit up, the room lit up. And I had no idea how dark my world had become from lack of oxygen.
Is a fascinating observation and description like that. And I think you told me your flow rates came down pretty dramatically.
Yes, I walked into the hospital on 7 liters of oxygen, and that wasn't enough.
Right.
And I left the next day using transtracheal oxygen on 3 liters.
With a good saturation.
Yes.
And the world kind of brighter.
Yes. Yes. And I never needed sunglasses.
I never even needed.
Now I do.
Yeah, that's great. Okay, so you got through those first couple of weeks, and I would agree with you. The first couple of weeks, sort of transitioning.
Yes.
How did it feel to kind of get your whole face back without the?
Oh, it was wonderful.
Yeah.
It was wonderful. I was getting sores from the nasal cannula.
Mm-hmm.
My ears began to heal, and my nose, it took it probably 2 months to finally quit bleeding.
No kidding, 2
Yes.
full months.
Yes.
Do you feel, this is sort of like the nose strip commercial, but do you feel like when you breathe in now compared to before with the scabbing and
Yes.
you're actually moving more air now through?
I can breathe through my nose.
Wow.
And it was strange because that's where the oxygen was going in,
Right.
but yet I was not getting enough of it.
It's almost antithetical in delivery
Yes.
to block up your nose and that blast oxygen up your nose.
Yes.
I want to get back to what you just said because I think it's very important. Most patients don't complain about their nose and ears with the cannula. Did you ever, and just be honest, but did you ever take it off to give your ears and nose a rest sometimes, knowing that, like, you know yourself so well that you could be off oxygen for periods of time? Did you ever just want to do this?
Oh, I did
God.
that a lot.
Yeah, did you?
I did that a lot.
Yeah, and things like blowing your nose with a cannula or trying to.
Yes,
Yeah.
it was awkward because there was a few times that I did forget to remove the cannula when I blew my nose.
Right.
And it's very insanitary.
Yeah, kind of, sort of. Huh? And how were you? And I'm going to say compared to other patients who are just won't leave the house wearing their cannula because of the more or less cosmetic effect or non-effect. Were you one of those patients, or did you not mind at all going to the supermarket or down to the gym or whatever?
I was very self-conscious.
Okay.
I was very self-conscious,
Right.
and it was hard to go out and do things. There
Yeah.
were a few times I could not make it through the grocery store.
Wow.
I had to just go to the front and sit down and wait.
Even on oxygen.
On oxygen,
Okay.
6 to 8 liters of oxygen.
Jeez. Well, that's a nice turnaround.
Oh, definitely, definitely.
Why? And I asked the other patient the same question, but it bears asking again. Why do you think this is our 29th year of transtracheal oxygen being a modality of therapy? And yet it's pretty hard to bump into one at the mall or the shopping. It's King Soopers or Safeway. It's kind of hard to
Yes.
bump into them. And I don't think all of them are staying home because they're on cannula. Why do you think in Denver area especially, doesn't seem to be a high utilization?
I think there's a lot of misinformation
Okay.
from the oxygen users I have spoken with on nasal cannula. They're told that it's high maintenance. They're told that it's a lot of trouble.
Mm-hmm.
They're told that they aren't bad enough yet. And I think all that is misinformation.
I want to go back to that last statement. You're not bad enough yet to need transtracheal oxygen?
Yes. And I would think that doctors would be pointing this out sooner, because one of the best ways found to delay
Mm-hmm.
the effects of lung disease is to exercise your lungs.
Correct.
To get them expanding and contracting.
Mm-hmm.
And the sooner that you are able to get enough oxygen to breathe, to be active, your lungs will be expanding and contracting. And I was not able to do that until I got on transtracheal oxygen.
Wow. So once you were on transtracheal oxygen, did you feel more energy, more?
Oh, yes. Yes.
How did it manifest? I mean, besides the light coming on, within the first few days and weeks, you had more energy during the day maybe, or sleeping better
Well,
maybe?
I noticed that I was sleeping better. I
Okay.
wasn't waking up with headaches.
Huh.
And I could walk up the stairs
Mm-hmm.
and not have to grab onto the kitchen counter and
Yeah.
wait for that
Yeah.
darkness to pass
Yeah.
and my oxygen to come back.
Have you ever been evaluated for sleep apnea? Just asking.
Yes.
Okay.
Yes.
None?
I didn't have sleep apnea.
Okay, good. Okay,
No.
just checking. So those symptoms of almost, the blackening out almost, or on the way up the stairs with activity, they're gone now?
They're gone. Oh, yes.
Yeah.
Yes. Those were gone almost immediately. And then it was adapting to a new routine.
Mm-hmm.
And after that, as it began to heal, that's when I began to get out of the house more.
Mm-hmm. And let me ask you, you have a partner, roommate, I'm not quite sure what.
Kathy, she's
Kathy.
my friend.
Your
We've
friend.
been friends for
Okay.
years,
All right.
and when I needed to move to Denver to be
Right.
closer to National Jewish,
Okay,
she offered me a place to live here in her house.
fabulous. Do you have other family in the area, or are you kind of solo?
Some,
Okay.
some, yes.
I'm curious what friends and or family see the difference in you before and after,
Oh,
or if maybe not. I just wonder.
They're amazed. I went back home to the little town
Oh,
I'm
you
from.
went back home.
Yes,
Cool.
and some people could not believe.
What town
how
is that?
much-
Just out of curiosity.
Little town of Sedgwick, Colorado.
Sedgwick, Colorado. Very cool. Very cool. But yet they, because what I find when I'm with family and a patient, a lot of times is he hasn't had that color in so long I can't remember, or he hasn't breathed that easy in so long I can't remember.
Yes.
Kind of, sort of like that.
Yes. And my sister-in-law,
Mm-hmm.
the wife of my brother that
Right.
passed,
Right.
when I left Sedgwick, she didn't know that she would ever see me alive again. I was in pretty bad shape.
Yeah.
And she's amazed at the progress that I've made.
That.
And it's all been since I started using transtracheal oxygen.
The medical literature, we have almost 200 published peer-reviewed articles over the years. So this has been a well-proven, scientifically validated. I mean, we have patients in Europe. We have patients in Australia, New Zealand, and yet, not that long ago, there were more patients in Amsterdam than Denver, Colorado.
Wow.
The doctors over there embrace, they test, they make sure you better do 5 patients. But once they see it works, it just gets added to the list of options they give to their patients. My goal, through talking to you and other patients, is to just get on the list of
Yes.
when a doctor says, when it ends in lung transplant, we've got a tweener,
Yes.
way tweener. Transtracheal oxygen is way, way, way less than
Oh, yes.
whapping in new lungs. And yet we don't seem to be on every pulmonologist list everywhere. And after 29 years, I just...
We have to figure out a way to get the word out.
Okay. We do trade shows, we do limited advertising. We get to every local patient event we can, active as we can possibly be. And yet you didn't sort of waltz right on through either, right?
Right.
You had to go through.
Go through the channels.
Right, go through the channels. If you were talking now to potential patients out there, what advice could you give them to help them find their way into the world of transtracheal oxygen?
Talk to your doctor as soon as possible about transtracheal oxygen.
Yeah.
Get informed. Get informed. Find the proper information and learn what it's all about. Learn how it can benefit you. If you are on nasal cannula and you could realize the benefits of transtracheal oxygen, you all would be lining up at the doctor's office to get this done. I guarantee it.
And I think now would be the appropriate time to just unbutton that top button and tell the folks out there who may be thinking about this in the future. Can I, if you don't mind, just a little bit more showing?
Oh, sure.
This is all we're talking about. A small, flexible catheter, comfortable, after it takes a sort of a set into your individual windpipe or trachea. Daily maintenance?
I change mine morning and night,
Mm-hmm.
and it takes less than 2 minutes each time.
Okay, so less than 5 minutes a day for care and feeding of the catheter. Maybe a little bit more in the beginning as you were learning?
Yes.
A little bit.
Yes, and it was self-cleaning then too.
Self-cleaning then too.
Or cleaning in place.
Right.
And
And I don't want to put any words in your mouth, but would you say most any patient could do this at home?
oh, yes.
Okay,
Yes.
yeah. And so there's no way to not ask this question too, but mucus,
At first there was a problem,
okay,
and now there isn't a problem.
right,
Sometimes, depending on the quality of the air living
Right.
in the city,
Yep.
or even out in the rural areas where there's dust,
right,
you can build up more mucus. And if that happens during the day, I just clean it in place
okay.
and use a small ampule of saline,
Mm-hmm.
and it causes a slight cough, and you can cough that out.
And in terms of your overall quality of life?
Oh, there's no comparison.
Yeah.
There's no comparison. I'm very active now. I walk. I have bought a bicycle. I can ride a bike now.
I'm so happy to hear that.
I walk to the local YMCA, and I work out there. And I've been doing that since the 4th month after I was put on
And I don't know
transtracheal oxygen.
exactly where it is, but like a couple blocks, 5 blocks, 8 blocks?
It's almost 2 miles.
2-mile walk?
Almost 2 miles, yes.
Way to go, Patrick. Very
So,
proud of you.
and now, because I have improved, sometimes I can get by without oxygen.
Mm-hmm.
And when I don't need the oxygen, I do have the ability to put a plug in the tracheal tube.
A lot of patients might be interested, a lot of potential patients might be interested in that. What's it look like?
It's just a small red plug that goes on the end of it.
Okay.
And it'd be beneficial if I can get off oxygen, or for those that just use oxygen at night.
Right.
And it's just a small plug, just like this.
Okay. And so that just plugs off the catheter?
Yes.
So it keeps the hole open, so to speak?
Yes, you just take your oxygen tube off of the catheter,
You've got the twist down good.
and you put this on the end of the catheter, and you do a quarter turn,
Yep, and it locks her.
and it's locked on.
Beautiful.
And then you can just tuck this inside your shirt,
Right.
and
Button
if
up
you're
and-
button up, and if you're out all day,
Right. Nice. That could be important for some of our snowbird patients.
Yes.
That don't need oxygen in Florida or Arizona when they go for the winter.
yes,
But need to keep the opening open so it doesn't close. But
Yes.
at the same time, if you don't need the oxygen, why drag the oxygen, right?
there you go.
And then when you get back to either altitude or wherever you live, if you do need it, off with
Yes.
the cap.
You just
Could you show us that? Take that off and reconnect and
take
show
the
them how
cap off
easy that is.
and the oxygen tube,
There you go.
and just plug it right back in, and you're back on oxygen again.
Seconds. Yeah, seconds. That also, if there are any clinicians watching, is the way we do pulmonary functions, because otherwise you would have volumes you won't believe if you lose the oxygen. connection.
Yes.
Yeah. So, tip for the clinicians. So I guess, you've really answered all my questions, and you've told, or at least you've tried to tell patients, what the benefits were to you. You're a younger patient compared to, let's call it the average age. And I'll just tell you, the average age of our patients is right at 66 and a half. So
Okay.
we've done many, many studies over the years. That's probably plus or minus 6 months. So you're going to get the benefit of this catheter for as long as you need it and as long as you use it.
Yes.
You can take that to the bank. One of the things about transtracheal oxygen that you can take to the bank, we don't make promises we can't keep.
Yes.
Okay.
Yes.
So we'll keep an eye.
And with an expected lifespan improvement using transtracheal oxygen,
Correct.
I'm looking forward now to a long, active life
Mm-hmm.
instead of a short, sedentary one.
Yeah. Your motivation to get up and begin to move and go down to the gym, was not there with the nasal?
No. I think people with nasal cannulas, I know in my case, and I
Right.
know in many other cases,
Right.
so much of your energy is just expent in breathing.
Mm-hmm.
It's very hard to breathe. It's a struggle to get enough oxygen. Once this is in place and you're getting oxygen directly into your lungs like you're supposed to, your energy level improves, which affects your attitude.
Yeah, and literally then you get into a beautiful cycle.
Yes, of positive rather than negative. Yes.
Well, I'm glad the room brightened for you, my friend.
Oh, it did. It did. My whole world brightened.
You look great.
Thanks.
I really appreciate you taking the time. Thank you, Patrick.
Thank you,
It was great
John.
meeting you,
It's
my
great to
friend.
meet you.
Okay, take care.
Take care. Thanks.
Bye-bye.
Bye.